Well, good afternoon, and thank you for joining us for the Los Angeles County Emergency Preparedness Updates. Um, as of the time of this recording, it's December 5th, 2022, 2 o'clock in the afternoon Pacific time. And let's see here, forgive me. All right, and speakers today, it's just going to be myself, Jason Belden, the Director of Emergency Preparedness for the California Association of Health Facilities. And we have a new program manager for our grant, but I don't have the name of the person who's starting, but we should have that disaster program manager for our next webinar in March. So let's just go over what we're going to discuss today and talk about some of the handouts. And hopefully this recording will be less than an hour, but we'll try to get it done as quickly as possible. And we'll discuss the DRC/Department of Public Health updates from Los Angeles County, as well as some state updates as well. I don't have anything necessarily from CMS. I do know that the public health emergency for the feds has been extended. We don't know yet for the state whether the state of emergency is going to expire in February or like the governor had suggested, or whether they're going to extend it based on the federal government extending their public health emergency. We'll discuss an upcoming Mercy after action report and improvement plan, and we'll review upcoming trainings and webinars. All right, let's go to the next slide. Just some acronyms that folks that we'll mention periodically through this presentation in case folks want to refer back to any of the acronyms. And there's 400 skilled nursing facilities, or roughly 400 skilled nursing facilities in Los Angeles County, and that's where those folks are located throughout the county. And there are 13 disaster resource centers located throughout the county. And just as a reminder, the disaster resource centers are where the county pre-stages or stages resources in the case of a disaster. That way, if somebody in Santa Monica needs some kind of resources, they're not trying to get them from the other side of the county. They can go to their disaster resource center, which is close to them, and that would be the person that would distribute those resources. That is the goal of the DRCs, and during COVID, we saw that challenged, so it's a little bit different in COVID, maybe a bad example, but everything else, that's kind of the way the system's set up to work. All right, and as a reminder, if folks don't have a contact for the DRC meetings, they are the DRCs. These are the contacts at each DRC center. And these are listed, these links and email addresses are on the slides, which are in the handouts for today. All right, whoops, there's Henry Mayo, LAUSC, Long Beach Memorial, and then PIH, Pomona, and Providence St. Joe's. And then they've got some DRCs that are for the pediatric folks, but we don't deal with the pediatric DRC. All right. I want to give you an update, and this is effective as of Friday, and this is a big change, or going back to this is going back to it. In any case, all staff, meaning everybody that comes into the building that goes anywhere where a resident may have access to, needs to be wearing an N95 as source control for every area of the facility. And then that's was effective Friday. And then, but if folks are working in a red zone or a yellow zone where they're wearing an N95 for respiratory protection, then those need to be fit tested N95 respirators. Whereas if you're handing N95 outs to folks that are working in areas where respiratory protection is not required, then they can wear a non-fit tested N95 as source control. But anywhere they have to wear a respirator as a part of the Cal OSHA requirements, you've got to make sure that they're fit tested. So hopefully that's pretty standard. You guys understand that now. But this is a big change. And when this will go out of effect, or when it will change back to regular masks for source control, I don't know. But for in the time being, we want to keep them N95s for everybody right now. All right. Separate guidance that was released at the same time as that the previous statement I gave you is that all visitors are required to test within 24 hours before they visit. And this is effective as of next Wednesday. That's December 7th, 2022. And the SNF, every SNF should offer over-the-counter antigen tests for visitors so they can self-test prior to the visit. And obviously, if it's positive, they're going to have to reschedule their visit until they've completed their isolation. You don't have to report these tests to public health. If you're doing the tests as a result, just the not the over-counter the tests, but the other antigen tests, then you would need to report those. So if you're using the OTC, you're okay on not having to report. In terms of if somebody gets a test outside of the facility, in other words, they say, oh, I got tested this morning, or I tested this morning on a home test, that is fine. That is okay with the county. It is on the honor system. They just need to verbally acknowledge that they have completed a COVID test and it's negative within the last 24 hours. And so what you want to do is document that you have asked each person that's come in and documented that they've had a negative test, even if it's a their own self-assessment that they did. That's fine. We just need to document that in case somebody from public health wants proof that we're asking folks about the testing. And then for folks that have not or have not indicated they've been tested within 24 hours, then we need to provide them the test in order for them to visit. All right. And as a reminder, LA County Department of Public Health has been sending out shipments of the over-the-counter tests. If your facility needs more, please don't hesitate to submit a resource requesting for more antigen tests. Consequently, or conversely, if your facility wants to temporarily stop shipments, if you've got an oversupply, please reach out to them and let them know that you don't need any more right now. And then separately, LA County Department of Public Health is going to be sending out a combination COVID-19 flu A and B rapid test kit. Those are coming from the state to the county, and the county is going to direct the shipment to all SNFs. So they're going to send these out to each facility based on licensed bed capacity, but you do need a CLIA waiver in order to be able to use those. And then shipments should start arriving this week for those test supplies. All right, and just as a reminder, I'm not sure if you saw this, but there was a letter that came out from Dr. Farrar, the LA Department of Public Health health officer. She sent out some recommendations about the COVID-19 bivalent booster recommendations. It's, obviously they made it, specific to or non-specific, and they just basically said it's recommended for everyone. But I want you to think about this in our patient population, or resident population. The effectiveness of this far outweighs the risk side of it, and it's much different risk-benefit scenario for elderly and immunocompromised and the folks that traditionally live and reside in long-term care. We need to increase our bivalent booster rate, and gosh, no time like now to start, as we're seeing a huge surge within the county. And then the LA County has a goal of everybody to get the bivalent booster coverage up to 80% or higher for the entire facility. I realize it's a much tougher discussion with staff, but really for residents, we've got to get the residents up there. I mean, there's no reason why our resident bivalent coverage shouldn't be just as high as our regular monovalent coverage. And right now it's about half as of what it was when we originally got folks vaccinated. So we've got some work to do to get folks there. it really is the kind of best tool and the foundation for all of our mitigation strategies from COVID-19. So it's really helpful, especially in our resident population. All right. There was another health officer order requiring each facility to offer treatment options for COVID-19 to every resident that has a positive case. And you know, the Department of Public Health really wants folks to be treated in place if they can. And so, but in any case, the evaluation for eligibility, the decision to treat and treatment should all be documented in resident charts, and facilities must make these records available upon request. So I realize I've talked to a number of clinicians about how difficult it is to, you know, do the entire process from convincing somebody to take it or documenting that or talking to folks' families to do it. And I realize it's a long drawn out process for each eligible resident. But the reality is combine these treatment with the vaccination and we can keep our folks alive. And that's really the most important message to take is we don't have one solution. We've got like 7 solutions and none of them are perfect. And so we've got to use all of the ones we can in order to minimize the risk of loss of life. So hopefully treatment is in your playbook now. All right. And then as a reminder, folks are not acutely ill. Just because folks have COVID-19, it's not a reason to transfer folks to a hospital. If you didn't know, the hospitals are really impacted, not just from COVID, but from flu and RSV right now. And so to the extent we can limit any readmission into a hospital at this point, it's going to be really beneficial, not only to that hospital, but to the resident, because they may have delayed care at the hospital because they're so impacted right now. So just think about that before you need to reinvent somebody back to a hospital. All right, so we had the Mercy exercise on November 17th. And for those that participated in the exercise, there's going to be an exercise evaluation webinar on December 14th. And this webinar is meant to guide you on how to document your identified strengths and gaps, and you'll hear about other strengths and gaps that others had. The goal is essentially to enhance resiliency and build capacity within the coalition, and it's also designed to collect information about your exercise experience so that we can improve for next year. I did receive a number of calls about providers asking, how do we participate? And well, one is we register for participation, but 2 is on the date of the exercise, we take all the exercise paperwork that was prepared for us and we conduct a functional exercise, which means that we're actually doing the work that we would do, except we're just simulating things like that. And the best way to give you an example is if you're simulating evacuation, and let's say in this exercise, or this particular exercise, you simulated that the radiological event happened somewhere close to your facility that would force you to consider evacuation. So let's say you want to practice evacuation. Well, that means physically moving things like you would do during an evacuation. That's preparing go bags, that's simulating movement of patients from resident room to a staging area, that's calling your transportation provider, and if you can get them to come out and simulate with you, that'd be great. If not, you're going to simulate loading folks up into a transportation. You're going to call a simulated recipient or someplace where you can transfer these residents to. So it's doing all of those things without actually moving the people. Now, we don't want to involve the residents. We don't want to put them in wheelchairs and wheel them around like we're actually evacuating, but we want to simulate the evacuation just like we do for a fire drill. Like when we do a drill, we practice specific things. Well, we want to do that during the exercise as well. And then once the exercise is over, you have a quick meeting with those who participated, and then you get some, what we call, strengths or gaps. And we really want to identify 3 things that we could do better, and 3 things we think we did pretty well. And those are going to be the strengths and opportunities that you share at the exercise evaluation conference. You're going to capture that information into an after action report and an improvement plan. And in the handouts for today's webinar, there's an exercise evaluation conference questions. That's what you're going to be filling out, and that's what you're going to be keeping for documentation as proof that you participated fully in the exercise this year. All right, the webinar is on December 14th at 8 a.m. and it's scheduled to end around 10:30. There will be breakout sessions by sector, so you want to select long-term care, and the link to register is right below. All right. And these are just some things that were, I think I shared these links last time, but I wanted to include them this time just in case. So there's a new guidance for wildfire smoke. We recorded a nursing home incident command system introduction. And so this is a virtual session. It's a 3-hour session recorded free on YouTube. There's a new electronic situation report, a new extreme temperature response plan, and an excessive heat warning that came out. These all happened since the last meeting. All right, so December 14th is one more training, and this is a ReadyNet training. It's from 10 to 11 in the morning. And you can register at the GoToWebinar link there. They also record these training videos, and they have a user guide that's available for download. Anyways, if you're not receiving email notifications, all of the stuff that I mentioned today was created and released and submitted directly to the facilities. But if you're not getting these, please contact the ACDC unit at lacsnif@ph.lacounty.gov to update your contact information, especially if you're a new administrator or new in your building. You send them an email and update your contact information. And then as a reminder, CDPH has their infection prevention Wednesday webinars, it should say every other Wednesday from 3 to 4 p.m. And you can register on the HSAG website, and then you can also download and watch, or download the slides and watch a copy of the webinars after we finish them as well. All right. Just a reminder, LA County has a Transforming Nursing Homes Together program. That program's in place, and there's a bunch of FAQs and material that was developed, and that's available on the TNT program website. And if you have questions about the TNT program, you can reach out to those folks at the email address below. All right, and these are the treatment options, and our COVID county or our county information is we're still in high transmission rate. All right, I promised the contact information for me on the last page, and here we go. So I'm not sure how long we've been going, but hopefully I'm going to get you out of here a little bit early today. I don't see any questions listed in the question box, but certainly if you have questions at any point, you can reach out to me. That's my email address, jbelden@caf.org. And my direct phone number is 916-432-5194. Thanks again, everybody. We really appreciate you taking the time to listen to our updates, and hopefully the next time we talk to you will be a really beneficial, we'll have had a really good holiday season and a happy new year. But we'll see you again in 2023. Take care, everybody. Bye-bye.